Hi, good morning, and welcome to today's session on the unit that we are starting, which is International Healthcare Policy. Now, for those of us who are actually doing the program with regards to the Level 6 and Level 7 Diploma in Healthcare Management, we will cover this particular unit as one of the mandatory units, as this is defined in the unit specification and obviously the course handbook. Now, this unit we're going to cover across in 5 weeks. There are 5 learning outcomes in this unit, and what I'm going to do is briefly just go over with you before we start, the unit specification of this handbook, this unit, and this would give us some idea in terms of how, we will cover it, and I will explain in terms of how the learning outcomes will be covered, and then in each learning outcome, what are we looking at covering specifically to kind of cover the unit. Now, this particular unit is important for those who are actually working as a healthcare professional or looking to get into, in this particular sector. It could be typically related to, anything that is directly or indirectly related to the NHS, care homes, nursing homes, adult care homes. And here, what we want to be able to do is instill some knowledge on, in terms of know-how and background about, what is healthcare policy, what are the issues surrounding the healthcare policy, how are policies formed within a particular country. And in this context, we will look at the UK healthcare system, which is in particular, we look at NHS and the related, set of services which NHS is able to provide. And then the idea would be to also try and understand what are the contemporary issues which typically professionals working within this sector face, and how these issues are overcome. What are the processes, what are the policies, and how these issues then are overcome with the use of these processes and policies. Now, the other thing that we will also concentrate on in terms of getting some well-rounded knowledge in terms of healthcare policy would be to look at understanding how promotion is done in this context, and what are the various routes which the government, in this case in particular, when we look at the UK healthcare system, the NHS, the National Health Service takes. And internationally, we will also look at bringing in some bodies like the World Health Organization, UNESCO, and the UN, which basically support projects across various countries to address, healthcare issues. And this is primarily done through the route of promotion, awareness campaigns, and working closely with local and international, at the local and the international level, at the government level, and also at the local level with various authorities to promote the awareness of, hygiene and how to maintain and obviously provide healthcare. Now, the overarching view in terms of, looking at this particular unit, if we have to look at a bird's eye view of what this unit, we are looking at basically focusing on the context of ATHE. That means healthcare policy from a perspective of studying the healthcare policy from a perspective of a particular country. We will obviously, put our focus in towards the UK or the United Kingdom, and within that, in particular, towards England and Wales, when we study the, or look into the details of the National Healthcare Service. From time to time, I will provide some handouts, which will also look at providing you elaborate knowledge to try and understand maybe one additional, healthcare system with regards to understanding this from a country perspective. Now, this particular unit is divided into 5 learning outcomes. The first one that we are looking at covering today will look at understanding healthcare policy formation in the international context, and it has some tasks associated with it. So if I just briefly point that, in that direction would be, so we are looking at covering learning outcome 1, and then in the learning outcome 1, using the presentation and the slides that I will run through, we will also cover some of these tasks which are directly related to your assignment brief, and also in relation to achieving learning outcome 1. The second learning outcome basically talks about understanding social and cultural issues in context of health and social care. The third one that we will focus on will be how, once we understand how the system is made, or how the policies in the systems are formulated, we understand social and cultural issues, we understand the various nuances involved in rolling out healthcare policy within a context or in a country or in a place. And once we've done that, then we understand what does the healthcare policy actually provision, what does it actually provide, both in the context of national and international level. So at the national level, we will study, for example, within the context of our own country, we will study the NHS and also understand how NHS works closely on certain humanitarian projects, or, in the cases of eventualities, environmental calamities, how do we collaborate with other international agencies to provide and facilitate health and, healthcare for individuals or people or population which are affected. Now, in the fourth link, we will look at some stage understanding, what are issues which are related to health policy, or in particular, we will be looking at, how the provision of promotion is done, to look at awareness, generation of awareness campaigns, which will actually raise awareness with the population in terms of the impact of, healthcare if it is not followed. And in some cases, we will also look at understanding things are run, in the national context. So in the case of UK, for example, we look at campaigns which are run to look at various charities in the UK. You see that on commercial television and advertising, that they run various campaigns on cancer, for example, how to avoid and detect early stages of cancer. We look at, heart diseases in particular. We look at sugar or diabetes, and some of these campaigns are run by the NHS at a national level, and they are promoted. Then they are basically, facilitated to go across to a wider range of audience. And this typically tends to happen through TV campaigns, print campaigns, and, awareness weeks, or, even events and all, events in tandem organized with different charities organization. And in the last learning outcome, what we are going to be focusing is really understanding ongoing issues, or contemporary issues means ongoing issues within this sector. And the idea would be to try and understand how some of the policies at the national level and the international level affect the implementation of healthcare and the various projects or various things which are carried out in this particular sector. How do they affect the issues, and how these issues are then dealt with in the context of, say, for example, a particular country. So this unit will actually set the foundation for us to learn how the healthcare system works within a particular country, and how decisions are taken, how policies are made, and once these policies, procedures, and decisions are taken, how are these rolled out so that the general population in a particular country is able to make use of these services within health and social care. So if you have any questions, for me, I would suggest that within the invite that you've received, if you see one of this particular circles on the menu, which has 3 dots, what you can do is, the next circle, which is showing kind of a alias or a human figure. If you click on that and you see participant list, and what you can do in that case would be to try and use the option to do a bit of a chat. And then through the chat option, you can actually, send across questions, which I will take up during the course of our discussion. If there is anything that you do not understand, or you want me to kind of go through it again, then please stop me there and then. And what I will do is we will cover that in a bit more detail with example of a specific nature to try and, obviously clarify that point. So if I minimize this for a second and I go on to the deck of slides that I have the presentation. So let's look at, covering the first learning outcome, which talks about, understand healthcare policy formation in an international context. Now, I've got about a couple of slides on this, which will give you a good overview in terms of how do we want to cover, this particular learning outcome. But in addition to that, once the session is over, I am also going to send you a bit of a handout for you to be able to read and go through to understand and obviously crystallize, this concept with regards to attempting the assignment and the tasks. So in the first instance, let's look at understanding, what is healthcare policy and why is it important. Now, in the first instance, when we look at, many countries, obviously, in any country, let me not say many countries, in any country, if you look at healthcare sector is an important sector as far as, the economy is concerned. now it generates a lot of jobs. It also has absorbs a lot of resources in terms of funds and finances, because it is generally subsidized or controlled by the government, and the funds and the financial funding of this sector is typically done within the national context by the government or the regional government or the federal government, depending on the country that we're talking about. So in this case, obviously, it will be something which is called the National Health Service. And in the UK, this came into existence after the post-World War II era, and this was then obviously first proposed in the Parliament in 1942 in the Beveridge Report, and then the former minor, which then went on to become the first Minister of Health, Aneurin Bevan, actually formulated most of the policies and procedures and the principles which actually laid the foundation of and the setting up of the National Health Service. Now, what do we see within the healthcare policy? Now, what we do get to see is that this particular sector actually consists of a lot of different things. For example, when we look at, if I understand from a point of view of just naming a few organizations which will become a part and parcel of this particular sector, would be companies which are pharmaceutical companies. We see hospitals, we see clinics, we see pharmacies, for example. We do see from a professional and working point of view or employment point of view, we see nurses, doctors, medical auxiliaries, pharmacists, practice managers, people who work within care homes, nursing homes. They all become a part and parcel of this particular sector. Now, health is something which affects all of us, and obviously in terms of having a secure system which provides healthcare to one and all without the process of any sort of discrimination or income levels and things like that, is something which is the basic foundation in terms of National Health Service. Now, some of the things that we need to understand with regards to how this system actually was formed and obviously led to the providing healthcare in particular within the UK, is something we will want to understand from a context of understanding and reading learning outcome 1. Now, what we want to be able to do is understand key terms first. So terms like policies, policy, for example, policies in general. Now, public policy, and also we look at things which are related to after having an understanding of the word policy, we take it and extend it to healthcare policy in particular. So when we look at policy, it is normally something which I would define as a thought which is which originates to take some decisions. And here the policy area typically would be health and social care in general, and this is then referred to, there are some suggestions in terms of what this policy should be, are brought across into some sort of a paper. And once that paper is published, there's a discussion and debate which happens on that. And once the discussion and debates kind of concludes to come across to some sort of a decision, then this leads to, the tabling of this particular white paper for discussion within the Parliament. And once this paper is tabled, discussion happen, it then turns into some sort of a bill, and the bill, when it is passed, becomes an act. So this process through which we go through when we look at creating some sort of a process which starts off with the origination of an idea, leading to discussion and debate, coming to some sort of a consensus, and then getting passed as a bill, and then forming into some sort of an act, would actually then become the whole process of policy formation with regards to a journal process. And if I relate this process to the formation of healthcare policy, that means I would include specifically in the remit of things like one of the key things that you could look at in the policy level would be that how many hospitals will be there, for example, how will they be funded, what kind of services will they provide. And when these set of questions are answered in that particular document, this then becomes something which is called the policy document. And this policy document relating to health and social care in general, which does provide coverage about how what the health policy will be, what are the assumptions, what are the institutions involved, how the organizations would work, what kind of services will it provide, and then the kind of funding arrangements which this system essentially will have, is all then a subset of what is called the healthcare policy. So healthcare and health policy for England is essentially the responsibility of the central government, or the ruling government, ruling party essentially. And in Scotland, Wales, and Northern Ireland, we look at it is the responsibility of the devolved governments, or devolved parliaments as we call it, wherein they provide the provision and funding for the healthcare policy and healthcare policy in general. Now, healthcare policy comprises of two broad sections. One of the sections that we will look at will be dealing with strategy, policy, and management. That means if there is a fundamental change which has to be brought across into the provision for these services and how these services are delivered, then it is going to be dealt under the section of strategy, policy, and management. And the other would be the actual implementation of this policy and procedure which has been set, agreed on in a form of an act or a bill. And that would mean that actual medical and clinical care, which is then provided by hospitals, pharmacies, by, for example, GP surgeries, or other related organizations which provides, it could be charities, community care, or, various other programs, or types of organizations which are involved in the delivery and implementation of these programs, would be considered as the second part of, the healthcare policy. So hospital-based care would be provided primarily through GP referrals, as we do. You do know that what tends to happen is if you fall sick, and this is something which is you need to be seen, you go across to your local GP surgery, and if there is, obviously the GP at that stage would look at diagnosing the problem, and if he's able to diagnose, prescribes certain medicines. If you get well and you're up and running, that's fine. If you don't, then at some stage you go back to the GP surgery and obviously speak to your GP, and in consultation, if it requires and the condition is not improving, then they refer you to the hospital, where the secondary care is actually provided, or specialist care is actually provided. In some cases, this could be tertiary care. So the idea on this would be to understand two broad categories. One is we are looking at the formation of policy and who does the formation of this policy, or how is this managed. And the second would be to look at implementation of this in terms of how, once this is there, how the services are delivered, who delivers these services. So in the first instance, we see these services being delivered by GP surgeries, dentists, and pharmacies, which is at the first level. The second level would be done by hospitals when you go in, and obviously it's something which requires further medical attention, and that's normally done at the hospitals. And once you've had the procedure, or for example, you've had an operation and you require, post the operation or the procedure, you require some care, that could then be given across by that would be then classified as the third tier of care or tertiary care, and that would be provided by specialist organizations. It could be a hospital. So an example here would be that if we do get to see that sometimes our soldiers actually come back from deployment and they have gone through some sort of post-traumatic stress or trauma. Now, in those cases, they are referred, they go to the GP, they get some medication, does not get resolved, go to the hospitals. Obviously, in that case, if it requires some clinical procedure, that is done. And at some stage, once they're discharged from the hospital, they need some physiotherapy. In this case, for example, if somebody has lost a limb or something like that, then they need physiotherapy. And that then tends to be the care, which is the tertiary care, which is provided across by specialist clinics or hospitals or associated government organizations. So this is something that we need to understand from a provision of how from the formation to the delivery of is actually structured. Now, over the years, the NHS has undergone a lot of changes, and these changes have now been enacted into something called the Healthcare Act of 2009, and this was established after the Nhs Constitution was formally brought together. And in this case, what has happened is the government and the related people who work within the sector have, over the years, after a lot of consultations, publication of white papers, created something which is called the Nhs Constitution. And this constitution brings together all the basics and basic principles of why the NHS was formed, what are the services it needs to provide, how it provides, and what are its values, and the mission and vision has all been incorporated into something called a centralized document, Nhs Constitution. Now, this was then made into a law, and then the rights and privileges and obviously responsibilities of patient, public, and staff was clearly defined out in the Healthcare Act. Now, NHS from a point of view of, this is more or less a journal information, but NHS is the largest employer in the UK, wherein over 1.3 million staff is employed, and with a budget of 90 billion. Now, this budget in current terms is about 120 billion. Now, over the years, the number of people working within the NHS has increased, and that's increased to 1.45 million, and the overall budget is allocated, to the NHS to provision for the healthcare services in the United Kingdom is in excess of 120 million, 20 billion, sorry. Now, from time to time, we've always heard and obviously seen in the news that the current, the Health Secretary, Jeremy Hunt, and obviously there is, ongoing discussion in terms of the NHS's cash trap, the onslaught of privatization which is happening within the NHS, and then NHS is falling short of budget or funds, is shortage in terms of funding. There are other provisional fundings which the government allocates and provides to the NHS, and that is apart from the 120 billion which was set aside in 2015-16, and then I think this budget currently is estimated to be about nearing 200 billion in terms of the total budget, and I think the staff in excess of, even though we hear of shortages that the NHS is short of 50,000 staff in terms of doctors, nurses, and healthcare professionals, we are looking at in excess of about 1.5 million people working within this sector, and the government actually providing funding and budgeting to the extent of between 120 to 150 billion. Now, this gives you a bit of a breakup. The next slide, which talks about what are the main groups which work within the NHS in terms of the context that we are looking at in particular is United Kingdom, and obviously the idea is to understand a bit of breakup in terms of the number of staff or people which work within this structure. So this gives you a bit of a distribution in terms of staff. Obviously, the figures are slightly old. They've been taken across from the NHS Information Center, and this primarily refers to, I think in current context, refers to about 1.45 million in terms of people or workforce employed with the NHS. Now, the other key thing that we also need to look at to understand, in terms of policy and the policy formation, before I go on to this slide, is the fact that when the NHS was, formed, and obviously the NHS Constitution was being formed, there were some principal approaches to policy formation which were adopted while providing, for the health service within the UK and to one and all in terms of population. Now, one of the key principles which was looked at was equality, equity, and policy. That means this was looked at from a point of view that anyone should be able to get access to healthcare or free healthcare service from the NHS within the UK. Now, healthcare policies were primarily formed through a complex interrelationship from a point of view of context, and they involved something called a triangulation of three services in particular. So what the policy, when the policy formation was done, it was based on something called the health policy triangle, and this health policy triangle consisted of something called the context, it had content, and it had processes. Now, what was the context point of view? Context basically meant that there were systematic factors like political, economic, social, cultural factors which were taken into context when forming the policy. Now, apart from that, what also was done was content in terms of what would be the substance of this policy, what kind of services would it provide, the key areas that it will deal with were also included in the discussion and obviously the formation of the NHS Constitution, and which laid the foundations for NHS. And the third was process. The process was that in what way that the policies would be initiated, how they will be developed, how they will be formulated, and then at some stage when the development has happened, how they will be negotiated, communicated, and then implemented was made a key integral part of this healthcare health policy triangle. So it consists of three things: context, understanding who will receive the service; content, what type of service will be provided, and in the process, how will this service be provided, in short, was actually made the central standpoint of the formation of policy or formation of the NHS. Now, there are lots of people who are involved in context, content, and process, and they were coined as, or termed as, individuals, groups, and organizations who provide and help in the formation of the policy, formation or delivery of the service, and then in the formation and the management of these processes as far as the NHS is concerned. Now, if for certain reason we do not understand this, then what I will try and do is send you a bit of a handout along with the presentation, which is on Moodle, to make you understand that why this healthcare policy triangle was important, or health triangle was important, to which led to the formation of the basic principles of equality when the NHS Constitution was formed. And this refers to the context, content, and process, because context is who receives the service, content is what type of services provided, and the process is how this service is provided or implemented, so that everybody can receive that service irrespective of the gender, caste, creed, and it provides the service from a point of view of equality, to one and all when they look at healthcare service. Now, once this was formulated, there are some other key organizations that we need to understand in this context. Is one of them in particular is called the National Institute of Health and Clinical Excellence, or called NICE. Now, this was established in 1999, and this was established as a body which was made responsible for developing national guidelines and standards related to healthcare promotion, prevention, and assessment of new and existing technology required to provide these services across to the population by NHS. So, in short, this as a body, when it was formed, it looks into things like what are the standards to be developed, how these standards needs to be adhered to, and then to a certain extent, what kind of technological aids which this particular which is required to be used within the NHS, and the standardization of those aids, or say for example equipment, services which these equipments will provide, would need to be looked into, were taken on from a point of view of under this particular institute, NICE. Now, when the healthcare research strategy for NHS was being implemented by another body, which is National Institute of Health Research, a total budget of about £1 billion was allocated in 2009 and 10. Now, this is another body which basically looks after which actually works within the NHS, and their aim in particular is to look at providing getting involved in areas of research which look at promoting or spotting, and obviously understanding what are the key areas wherein there needs to be changes which need to be brought across in the short and in the long term. So from their point of view, this particular body works very closely with the NHS, and they are responsible primarily for looking after issues or areas which can actually become in the short and the long term. And their aim is to primarily look at raising concerns and looking at understanding appropriate models to be able to address those issues. So it is a body which basically looks at conciliatory requirement and demand, and and here in particular what they look at is they look at collecting a lot of data from the various outlets within the NHS, and that data is essentially collected, and then research, the idea of having the research done on that data is to primarily improve the style of services which can then be provided, by the NHS. Now, some of the areas here could be looking at, things like which are ongoing areas of research, like dementia, because we have an aging population at this moment. What we are looking at understanding is that the aging population, we are discovering new types of disorders or diseases which do not have a cure or a definite cure at this moment. And from that aspect and point of view, those are areas which this particular institute looks into, like dementia, cancer, for example, any future areas wherein clinical trials would happen, how they will be conducted. So these areas are then looked at under the National Institute of Health and Research. So in effect, we look at three different bodies. We look at the NHS, National Health Service, how it was formed. We look at some of these supporting bodies and the acts which were created over the years to formalize this as a structure. We look at the Healthcare Act of 2009. We look at one of the institutions, which was the NICE, which is National Institute of Clinical Excellence, which was created. And then we also look at the National Institute of Research, which basically helps, health research, which basically works very closely and is a part and parcel of this organization to provide healthcare services, but their main area being to do research, to look at, how to identify these issues. And once these issues are identified, look at finding solutions so that they can then be appropriately brought into policy formation and then put into implementation at an appropriate time to meet the requirements of the growing need of services which the NHS provides. Now, the other slides that we will look at in particular would be to once we've understood how the policy formation has happened using the healthcare triangle, for example, and then when we look at the context of UK in particular, and then from then on, we look at understanding how funding towards this particular policy, or the service is done. Now, NHS, which is what is we understand National Health Service, is basically, 100% funded by the government at this moment. So most of the services that we need to get from the context of, healthcare in particular, are provided free of cost to people, on the basis of their needs, and they do not need to pay anything. And this is purely funded by the government and the taxpayer in terms of national insurance contributions. Now, over the years, what has happened is there has been a prescription charge which has been introduced, and these charges, when they were introduced, have started to increase over the years. But in some cases, wherein the devolved governments have taken decision, the prescription charges are either lower than what we pay in England. So, for example, in England, we pay, I think, £7.60 or something like that in that region for a prescription at the pharmacy. But this might be, absolutely free in Wales, because the devolved government has taken the decision that, we will not pay, or we will not expect the public to pay this prescription charge. I think in Scotland, probably it's the same, but there are some charges which are applicable in Northern Ireland. So this is dependent on how the decisions by the devolved government is taken. And then in this case, the funding to a larger extent is what we need to understand is for the NHS is done by the government centrally, and then in some cases the budget allocation happens to the devolved governments in the case of Northern Ireland, Wales and Scotland. But predominantly the system is funded through the contributions from national insurance and also by the central budget. Now, in terms of understanding how this works within our context, let's look at UK in particular. Now, here, what we tend to understand is that there are some, sections of the Act which were introduced. So, for example, the Healthcare Act in 2009, the Section 242, for example, talks about that trusts have a legal duty to engage and involve patients and the public. So, when we look at public consultations which tend to happen within the formation of policy, now the government does not stand alone decide how or what changes are to be brought across in the policy from time to time. Now, if they decide that there are policy changes which need to be done, there is a mandatory, way to implement these changes, but they go through a structured process of approval. Now, in most cases, you will see that when something in terms of a change is to be introduced, what tends to happen is the government will publish some sort of a paper. And this paper, when it is published, is then debated at the regional and local levels by councillors or, key groups or key policy groups, which essentially help in policy formation. Once this has been debated and discussed, they come out with something called a white paper, and that white paper is then tabled into the Parliament. Now, once this is tabled into the Parliament, there is further discussion that happens in the House of Lords and House of Commons. And once this is agreed after the debate that these are the relevant things to be implemented, and this is what the engagement will be, this is what the change in policy would be. So context, content, and process. So once these three things are put in place from a point of view of context, why this change is required and why it is being done, content, what are the changes being proposed, and then process, how these changes will be implemented, which is the healthcare triangle that we look at. That is becoming the basis of policy formation with regards to any changes which are introduced into the NHS Act or the Healthcare Act in particular. So like in this case, Section 242 is an example that, okay, it involves feedback from the patient. It also involves third-party agencies or people who receive, care in general. And then this feedback is incorporated into a white paper discussed at the Parliament. And once this is done, then it's introduced as an addition or as an addendum to the Act or the law which is already available. Now, there are some agencies which do participate in this because this is not purely as a process handled by the government alone. So there is one such institute or agency which works in terms of doing annual surveys. And this, from a reference point of view, is the Pickers Institute. And they basically look at collecting a lot of data from patients in particular who have received services over the years or have gone in for certain procedures or operation and then have received that service. So they tend to collect all research and feedback, from the patients through the route of surveys, and these are then sent across and collated centrally by the Pickers Institute to come out, with some sort of, I would say, reports, annual reports, which are published every year. Now, there are certain other organizations. Now, sometimes you get to see that there are disputes which open up, and in the recent couple of months, what we've seen in the news is that there are some trusts within the NHS which run hospitals have been put into, by the Quality Care Commission, CQC, have been put into, kind of some sort of a notice saying that the quality in terms of the service being provided has led to loss of life. Now, in some cases, when you have disputes or arbitration which basically arises, then the Patient Advice License Service, this is another independent body called the PALS, which basically looks into such complaints and complaint procedures. And from time to time, you'll also see that there will be some involvement of local, networks or charities which primarily facilitate, tertiary care. When you've had a procedure, when you've had some sort of a treatment which has happened, and over a point in time, you've been referred on to a third-party agency which will help you recover, after receiving some treatments. They then tend to also collect feedback, which is then fed into, the annual surveys before, anything in terms of an addendum or a change in the act is introduced within the NHS. Now, one such example which I'll give out in this case to explain this would be that over the years, what has happened is the government has always allocated budget for the primary healthcare services, which is delivered to the NHS. But there are three main concerns which any healthcare system currently has in developed countries. One is the case of aging population. Second is the discovery of new medical disorders or new disorders which are being discovered due to modern lifestyle which we have currently because of being in the developed nation, as a developed nation. And the third would be the certain set of or disorders which have come to light but still do not have a cure. So, for example, when we look at certain disorders like certain cancers, we look at certain disease, sexually transmitted diseases like AIDS in particular. Now, there is no definitive cure for that. So when we look at these three particular, areas, what we do get to see is that up until 2009-10, most of the provisioning for the NHS in terms of funding was done as the healthcare budget. But after that, the government has started to put some provisioning in for the mental healthcare services as well. That means things like dementia, things like cancer, things like care required for the elderly. So there are budgets which the government is actually putting into place, and this has come across as an issue or as a point which was discovered initially by the National Institute of Research, Health Research, and then this was a study was carried out, and obviously after that the government has done some consultations, published some white papers, and once this has been recognized that there needs to be separate allocation of budgets for the mental health care services in particular, or certain other types of services which are required because of the aging population, like for example taking care of our adults or aging population, then this allocation of budget which has happened has led to the creation of separate budgeting happening within the healthcare budget, these services. And this is something which is an example, which I would say is an example of how the change was detected from a point of view of research. Once the change was detected, the publishing of white papers, consultations involving the public, the agencies which work within the healthcare sector to provide this service. And at some stage, once this has been done, it has been approved, discussed, debated. There's an amendment which has been brought on, and that amendment basically talks about, provisioning for this particular, in terms of service as a budget separately under the healthcare budget, and that is the mental health care services. So last year, Theresa May, for example, put aside £1.2 billion just towards mental health care services, which is a separate budget, which is a separate funding pot under the overall budget of the NHS. So sometimes these changes in the national context are introduced over a point in time after detailed consultations and involvement of relevant agencies to make sure that the feedback is taken in from all relevant sectors or all relevant types of organizations working within that sector to be able to provide service, and then that change is introduced. Really, there are, when we look at the structure which in England and Wales, we also look at there are similar structures which are present, in the other devolved parliaments, and then that they are then held responsible to basically, set the policy and the strategic direction, and also monitor and evaluate performance, for these services which are provided within that geography. So let's look at Scotland in particular. So here the NHS boards, were like in England and Wales, the NHS boards were replaced by the PCC trusts. I think we have about 20 different PCC trusts which manage over 145 odd hospitals within England. So similarly in Scotland, NHS boards replaced the trusts, and then what happened over a point in time is that these boards are responsible for setting the direction. They look at managing the performance and the standards, and also set and establish the clinical governance through which these hospitals and these organizations of the primary, secondary, and tertiary care operate. Similarly, in Wales, the National Delivery Group, which advises the National Advisory Board, is a body which performs similar functions to what the NHS board do in the context of Scotland. Wales, obviously, some add-on slides just to explain that. So in Wales, obviously, the local health boards, they plan, secure, and deliver healthcare services in their areas, and there are 3 basic NHS trusts which provide emergency, cover for other related services, which are, for example, emergency. When we look at A&E in particular, we look at cancer, and also look at public healthcare services in tandem with, services provided elsewhere in the UK. Now, in Northern Ireland, there's a single body, which is the Health and Care Board, which oversees the commissioning, performance, and resource management, in particular to provide, the services of healthcare to the 1.4 million people, 1.4, I think, approximately 1.4 million people in terms of population in Northern Ireland. And they then cover, the 6 different health and social care trusts which deliver these services within Northern Ireland. Now, sometimes you get to see patients do get referred from Northern Ireland to England or Wales because the waiting periods for certain types of treatment are quite long, and in some cases, some of these treatments might not be available in that particular geography. So in those cases, there is a clear working arrangement and a relationship wherein these patients are then referred on to specialist facilities, in England or Scotland, in the case of, so that there is no delay in terms of providing the care required to save life or, to provide that service to the person or the, in general, the public. Now, looking at these are slides which slightly different in terms of how these services are being rolled out in the case of UK when we look at. So there are a lot of healthcare agencies which support the National Health Service in particular to provide services. And I gave an earlier example of if somebody has gone through, say, an accident, and in that case, you've had a procedure within the hospital, but after you have been discharged, you need physiotherapy. That might not be directly provided by the NHS, but you might be referred to get into some physiotherapy sessions to be able to obviously get back to normal. And these sessions or sessions which are arranged could be arranged through third-party agencies or ancillary agencies which provide this care after you've had the operative procedure at the hospital. Similarly, you see the growth of community health services or community health councils, which over the years have now become a part and parcel of different communities, wherein here these bodies, they act as tertiary bodies to be able to provide service to people, say, for example, in the case of drug addicts in particular, or we look at people who have suffered certain types of disorders like some sort of traumas and things like that, and they need a bit of time to recover, but there is no actual clinical procedure involved in terms of hospitals or undergoing an operation and things like that. So in those cases, the community healthcare councils typically step in, and the support is provided through community care-based agencies in particular for the people to be able to recover. So, for example, if you're leaving a smoking habit, you might be able to join a local club wherein you meet once a week, and these volunteers or these agencies which basically run these clubs would fall under the community healthcare or tertiary agency. There is one part of, I think when we look at, it is important to state here that there are lots of changes which have happened in the NHS. But the changes which have happened after 2010 in terms of the healthcare policy are something which is often, let's understand those changes. They are important to us because over the years there are lots of changes which have happened, but the ones which are important are the ones that we could look at in the last 10 years from a point of view of study. So when we look at post 2010, after the introduction of the NHS Act of 2009, it kind of worked on the 3 Ps, which basically talked about predictive, preventive, and personalized medicine. And this predictive medicine, basically meant that here the idea was that proactively, the treatment need, if there is some sort of a disorder or disease which is being diagnosed, then it has to be proactively diagnosed, and a treatment of that has to be provided on an immediate basis, so that this can then be preventing maybe post-operative procedures which are required at a later stage. So in the case of, say, with an example, if I explain, in the case of, say, breast cancer, in the case of obesity, or in the case of diabetes, the idea here is to detect these, these conditions, and then look at some sort of predictive, discovery of these conditions, and then prescribe medicine so that they can be avoided altogether, or the individual in this case can be sensitized on these because of the family history, or maybe if this is something which is which could lead to some sort of a disorder in the future. And that is where the concept of predictive, preventive, and personalized medicine came in. So when you register in the GP surgery, for example, what they tend to do is they take a detailed medical record and a family history of your, in your case, take your family history. The idea of understanding that would be to try and see if you are susceptible to any particular type of disease or disorder because of your genetic makeup or the family background. And this then is focused on the fact that if we know that you've had, say, for example, a family history of having diabetes, then in those cases, there would be some predictive and preventive procedures put in place, within the GP surgery, that you would be, getting information prior, so that this is something that you can try and avoid, and the idea here is to try and sensitize you of these, cases which could happen with you in the future because of your family history. And the idea would be to try and put some sort of, preventive medicine or therapy in place so that this can be avoided, and this helps to save costs for the NHS in terms of future as well. So benefits to the patient, but also in terms of long-term benefits to the healthcare system. Now, in some cases, tailored healthcare has to be provided, and this has to be provided because of the fact that that would mean, for example, if there are lots of people who are waiting, say, for example, to receive organ transplant. Now, they would typically require tailored services. Now, in this case, the tailored services could be if you're, for example, waiting for a kidney transplant, you then are put onto a national donor record wherein the first availability of that, would basically invite you in to, come and get that organ replacement done. But because you're going through the process of, say, dialysis and a couple of other things at your end, here, some of these services which the NHS would then provide would be provided to you, which are tailored to meet your daily, routines, and obviously to help you get on with your daily life. So, for example, in certain cases, some of these services are provided to the patient at their home. There will be healthcare professionals which will be working or, visiting you regularly to help facilitate maybe changeover, or, in some cases, look at a change of equipment, change of, medication. And that is primarily to ensure that, personalized care is also provided in the case of patients which require it, from that context. So the fundamental principle of the 3 Ps, predictive, preventive, and personalized medicine, was brought in after the, the changes introduced in terms of the Healthcare Act, and this is then implemented post, 2010. Now, thing to briefly go through, go through some of the other stuff is basically looking at that. Now, the PPP is explained out in the next few slides, which basically talk about why this as a concept came about and why why this has been implemented, because this helps the NHS to respond to some of the challenges because of the advancement in the healthcare which has happened, the introduction of technology which has enabled the detection of some of these disorders and diseases, and then for example, a clear indication is that today you can look at certain services like 360 XP, which allow you to kind of look at your genetic genome and composition, and that allows you to look at if you are susceptible to certain types of diseases or disorders because of your family history. Now, because of these technologies which are now available, allows the NHS to also look at putting this in place by following the principles of the 3P, and that allows let's put it this way, 3 different advantages. It basically allows it to be detected early, it allows that to be treated effectively, and in some cases it allows the NHS to also provide specific and tailored services to avoid serious consequences when these things do happen. So this particular context is made possible because of the advancements in technologies, and some of these being detected because of the use of technology happening within. When I say technology, it could be equipment, it could be medicines, it could be diagnostic procedures which are now available and which make it possible for you to basically receive this treatment and then get back to normal life as quickly as possible. A case in point here would be, say for example, if you still have to go through say for example, if you have a heart disorder, that means you have a bit of a blockage in one of your arteries. Now, in the olden days, obviously, it used to be treated through an open heart surgery, but now people are put onto a waiting list. They're put onto some sort of a medication, blood thinning, medication, which allows you to kind of avoid the operative procedure to a certain extent, and then if it allows you to basically put forward that operative procedure to a certain extent, but at a stage when it is required, it then allows you to go through an angioplasty or an angiogram, which allows doctors to remove the blockage by putting in stents, And at the third stage, if this is to happen and it leads to, when it has serious consequences, that means if it is not operated, then it can lead to a loss of life. Then in that case, you undergo a procedure, and that procedure then allows them to look at doing, either an open heart surgery or stenting if required going further. So this 3P as a process allows, it has been made possible because of the successive, advancements in technology which have happened over a point in time. And some of these things which the NHS as a provider provides sometimes, are provided through third-party, agencies because of maybe, lead times in terms of wait times and other things. And sometimes you might be asked to go across and get this procedure done from a particular organization as against directly happening within the NHS. So that could also happen, but all the services are paid for by, and the services are free. So this is also happening in the case of, cancer screening programs. You look at child healthcare promotion programs. So there are lots of charities which get funding, from the government. And the idea here is that if this has been identified as an area of, concern, then there are other organizations which are brought in to facilitate the delivery of these services apart from the NHS, and they then help in creating a national coordinated response towards some of these serious areas which need to be tackled or need to be looked into because they are life-threatening in terms of conditions. So the task basically, when we look at learning outcome 1 in particular, we are focused on understanding how the system works from a point of view of context, what kind of services it provides, and how these services are provided. So in this particular presentation, what we are looking at as a summary is the understanding the formation of NHS, looking at what are the other bodies which are which have been formed over the years, which support, control, monitor, and also direct the policy formation within the NHS, and obviously support them in terms of kind of providing 360-degree services, like in terms of once the policy has been implemented, changes have been done, feedback is collected, and obviously that feedback is again fed back into the system after a period of 3 years, 4 years to look at changes which could better, the services being provided. Now, there are certain reports which are good reports to look at some additional reading, and these reports which help you understand how the healthcare policy formation happens, what are the goals which are done, why these changes are brought in. And one such report, which I put 1 or 2 slides on, is basically the Darcy report, which talks about the 6 key clinical goals which were set up in the case of preventive care in after 2010. Now these were done because there was a clear identification of some of the modern day diseases or modern day lifestyle symptoms which are impinging additional burden on the National Health Service, and they were looking at tackling that point of obesity, alcohol or drug addiction, the contribution of smoking or smoking related disorders, or the cost on the NHS, and then looking at improving how the improvements can be brought across in the mental and sexual health within the system to provide these services. And that is what we look at within that report. If you read that report will help you understand that how these issues are identified by the area of research, by different bodies which contribute and bring across these issues. They are discussed, and then within these issues, when these are discussed, the report then focuses on the idea of how they can be addressed and what policies need to be put in from a future perspective to minimize the effect of these issues on the NHS. So this report basically, I think, would be a good reading to understand that how they did a bit of a review. Over the years, there are a lot of reviews which are done, but every 5 years there are reviews done. So this report focused on reviewing, how high quality care can be provided, considering these 5 or 6 factors, which are coming into because of our, modern day lifestyle. things like obesity, alcohol, smoking, and what kind of pressures or what kind of issues these actually provide when we look at or create essentially when we look at the impact on the NHS and the services it provides. So this particular report, I will send across a summary document to you, which is 1 or 2 pages for you to be able to read. And then this paper, which was published, a report of the paper which was published, actually looked at talking about things which meant that it paid emphasis on how the the healthcare promotions should be done, or what is the role of health promotion within healthcare, and why some of these things need to be highlighted and brought across into public light so that people are made aware in terms of how to stay healthy and how to obviously avoid these conditions. And this report had 6 particular parts which was presented in the paper, and these 6 particular areas were identified as key areas for making improvements within the NHS. So how these services within the NHS have to look at 6 particular areas which are going to be major challenges for NHS going forward in the UK. Now, slide leading on from the DASA report, basically talks about the challenges that we are facing, and some of them I've kind of mentioned earlier, that we are looking at NHS budget expanding year on year, life expectancy in terms of everyone living longer, some of the other chronic diseases being discovered, cure for some of the diseases not being available, and then the negative effect of our modern day lifestyle, which is leading to the creation of new disorders or new diseases, in particular diabetes and cardiovascular or heart diseases, and how these challenges are to be addressed by the but this particular slide, which I have put in, primarily for you at from a point of view of understanding. From a point of view of understanding, let me just enlarge this. From a point of view of understanding, what is the NHS structure in particular. Just 1 second. So if you see this particular slide, just 1 second, to share the full screen and then make it full screen. It gives you a bird's eye view of how the full structure. So the key aspect of policy formation, Parliament, the national, obviously the Secretary of State, which is the Health Secretary. Underneath that, you have the strategic health authorities, the primary care trust, PCT trust as we call them, and under the trust you see what you call is the 5 set of services, which is the NHS Foundation, the NHS Act. We look at the healthcare, mental health care services trust, and the acute hospital trust, and underneath that you have this particular operation is then quality controlled by the CQC, which does monitoring on these organizations to ensure that the quality standards do not skip. So this is the structure within England. We have a small, slide that I've put in for Scotland, a brief structure for how it is organized in Northern Ireland, and then how it is organized in Wales. So this gives you a bird's eye view of how the full system is structured across, the 4 devolved countries that we have. So in general, the NHS, but when we look at specifically NHS England, NHS Wales, Northern Ireland, and Scotland. And the next slide basically talks elaboration into the 3 Ps, the preventive medicine, and what NHS is basically looking at doing to provide these services going forward, from a point of view of changes implemented in 2010. That is where I would kind of, stop today's session. The key takeaways that I would mention would be how healthcare policy formation happens within a national context. So from our aspect, we've looked at the NHS, in particular the UK as a country or a context. We've looked at the content in terms of what are the services, what are the key bodies which enable the provision of these services, and what are the key bodies apart from the NHS which actually help in capturing feedback, say for example, from the market, from the public, from the third-party agencies or key bodies which are involved in the delivery of this service, and what kind of services are provided. And then briefly, we've looked at the reference to one or two things. One is in particular looking at the challenges which the NHS faces, and the next is, understanding the DASI report. And then last but not least, how the funding in particular happens for the NHS, and then the services being delivered in the 4 different devolved parliaments, or 4 different devolved states, from a point of view of the provisioning of healthcare service. Is that okay?
Yes.
Good stuff. So, any questions on this so far? If there are no questions, then what I'm going to do is I'm going to stop the session here for today, and then this presentation is obviously available on Moodle. But in addition to this presentation, let's look in terms of what all is available for us to look at. And I think from my point of view, if there are some handouts which I can do, is I will send this across. Let's look at level 6 first very briefly. So when you look at this particular LO that we are covering, this is L, and in L1 we have the healthcare promotion framework. So what I will do is, I think I'll need to add 1 or 2 handouts which are there, which in particular is the policy from the principal approaches to policy, which here to understand NHS, the overview which is here, how the policy is made, and then how do we understand healthcare. So these 4 handouts are related to your learning outcome, and I would suggest that this is a bit of additional reading that you need to do. The Word document in particular is only 1 page, in a sense, to understand how policy formation happens, and this is the context of the health policy triangle, which I briefly explained. So this document is already there. And apart from that, there is another document which I would suggest you need to look at, would be the PDF document which talks about the overview of NHS. It is to give you some background and understanding of how the NHS was created, the workforce, and some of the information which is in this document has been taken into the presentation. So for example, the structure, I've actually borrowed it from this particular, handout which is there. And then last but not the least, mine would be to go the slides, which we have understood today, and then try and understand the topic learning outcome one from this context. So I will tomorrow on the second session, and we will continue our discussions going forward, to learning outcome 2. I will put an email after this, as always, and this will include, an extract of the DASI report as well, which will help you cover, some of the challenges which the UK healthcare system is facing in general with regards to future policy formation, going forward in the, going forward in this particular parliament. So, if there are no questions at this moment, I'll stop